Good morning, I'm Joe Fryer.
And I'm Savannah Sellers. Right now on Morning News Now, imminent threat. New developments overnight with more than 1,000 U.S. citizens still in Afghanistan, now being warned to stay away from Kabul airport. This as the Taliban tells NBC's own Richard Engel it's time to get out.
How are you feeling right now after 20 years and the Americans are leaving?
The withdrawal is almost finished. These are our happiest moments.
We'll have more of that exclusive interview, plus the new challenges to evacuate people safely as America's longest war comes to a chaotic end. Overwhelmed hospital workers calling for help amid a nonstop flow of coronavirus patients. We'll take you inside one hospital operating at nearly 200% capacity, plus how FEMA is stepping in. Final showdown. Lawmakers in Texas back at the state capitol to finish their fight over a controversial election bill. We're there as Republicans push for a vote following a several-month delay. And security risk, privacy concerns now on the menu over those virtual QR codes made popular during the pandemic. Why the contactless system is now raising red flags. And once again, we can say there's one more thing for you to worry about.
Exactly.
Sorry about that.
We'll have good news, too, don't worry.
Yeah,
In fact, there is some
absolutely.
good news. It's someone's birthday today.
It is my birthday, yes. Thank you. You're so sweet.
And you chose to work.
I know. Well, I'm out of here after this, so I won't be with you tomorrow to take a little break. But thank you so much. And there's nowhere I'd rather be. No one I'd rather be with on my birthday morning. And with all of you at home, of course. And we begin this morning in Afghanistan, where the U.S. and other countries are now warning people to stay away from Kabul airport amid growing fears of a possible terror attack there.
The threat comes as thousands of Afghans gather at the airport, vying for a seat on an evacuation flight before next Tuesday's deadline. But in an exclusive interview with our Richard Engel, a Taliban spokesman said he hopes those Afghans will stay when asked if the Taliban would let them leave in the future.
We don't want our countrymen to go to America. Whatever they have done in the past, we have given them amnesty. We need young, educated professionals for our nation. But if they want to leave, it's their choice.
What would you say to women, Afghan women, who are terrified?
They are our sisters. We must show them respect. They should not be frightened. The Taliban are humans and from this country. They have fought for their country. Women should be proud of us, not scared.
We have a team following the latest developments this morning. NBC News White House correspondent Jeff Bennett and global correspondent Raf Sanchez is in London. Jeff, let's start with you. So what are U.S. officials saying about this terror threat at Kabul airport? How serious is it?
Well, in an alarming sign of the deteriorating security situation around the airport yesterday, the State Department warned Americans who might have been gathering outside to evacuate 3 gates leading into the airport. Of course, the Kabul airport is the only way for Americans right now to find their way out of the country. And so the window for evacuations is closing quickly. 5 days remain until we arrive at President Biden's self-imposed deadline there for the full withdrawal of U.S. troops. But there are questions about when exactly the Pentagon will switch from ceasing the evacuation of civilians to withdrawing U.S. troops, withdrawing and destroying equipment there at the airport.
And now, Raf, it's actually not just the U.S. that's issuing this terror warning. What are British officials also saying about this?
Savannah, that's right. The UK has around 1,000 troops in Afghanistan right now, serving alongside American forces at Kabul airport. And the British government is echoing that warning from the United States, saying to its citizens, do not go to the airport. And if you're already there, get away, get to a safe place. A UK defense minister said today there is an imminent threat of a, quote, highly lethal terror attack in Kabul, potentially within hours. Take a listen to what he had to say.
I can't share with you the exact detail of what the threat is, but I can say that over the course of the week, the credibility of the reporting has reached the stage where we believe that there is a very imminent, highly lethal attack possible within Kabul.
Now, the UK and other allies tried to convince President Biden to extend his August 31 deadline for keeping U.S. troops in the country. They weren't able to change his mind, and so the British are also getting ready to pull their troops out over the next couple of days. Savannah?
So, Jeff, Secretary of State Antony Blinken said yesterday about 1,500 Americans are still in Afghanistan. So where does the evacuation effort stand, and how could this terror threat around the airport impact that?
Right, and the secretary said of that number, the U.S. is in constant contact with about 500 Americans, and the other 1,000 they are frantically trying to reach. But we also heard from Secretary Blinken that if there are Americans or Afghans who remain in country beyond August 31st, and there likely will be, he said that the U.S. will spare no resource, diplomatic, economic, to help those folks find their way out. Here's a bit more of what he had to say yesterday.
But let me be crystal clear about this. There is no deadline on our work to help any remaining American citizens who decide they want to leave to do so, along with the many Afghans who have stood by us over these many years and want to leave and have been unable to do so. That effort will continue every day past August 31st.
But as you can imagine, there are more questions than answers right now about how that process would work. What potential third-party country would remain there working with the Taliban to keep that airport open and functional, Joe?
Yeah, absolutely. And Raf, we just heard from the Taliban spokesman there in this interview with Richard Engel saying he wants Afghans to stay in the country and that the group respects women, that they're their sisters. Do people believe that message at all, or are they still focused on getting out of the country?
Yeah, every indication we have right now is people who were planning to leave the country are still planning to leave the country. We are not hearing from folks who are suddenly reassured by what the Taliban are saying and are deciding to stay. People remember very clearly the brutality of the Taliban regime that fell 20 years ago. They remember women forced to wear burqas. They remember women being stoned to death after being accused of adultery. We should say we are less than 2 weeks into this new Taliban regime. We don't yet have a sense of what their social policy is going to be. They are very focused right now on the basics of government, security in the cities, collecting the trash, getting the traffic moving, manning the border posts, things like that. But the real fear for people in Afghanistan, and especially for women, is that once this new Taliban government settles in, consolidates power, they're going to go back to that very harsh system that they had in place 20 years ago. Guys.
All right, Raf and Jeff, thanks so much for kicking us off. Appreciate it.
Hospitals around the U.S. are once again at max capacity as they deal with a surge in COVID patients. In Mississippi, the state is working with FEMA to deploy additional healthcare workers to some overwhelmed hospitals. NBC News correspondent Ellison Barber joins us now from one of those hospitals awaiting help, the King's Daughters Medical Center in Brookhaven, Mississippi. Ellison, good morning. Thank you for being here with us early. So what's the state seeing now in terms of COVID cases there where you are in Mississippi, and how will this emergency deployment of staff there to that hospital work?
Well, so in terms of the vaccination rate in this state, there's a little bit of good news on that front. Vaccination rate, it rose again last week. It's risen by more than 125% in the last month. But in terms of the infection rate, the hospitalization, the death toll, those numbers are still not at all where the state would like them to be. Just look at some of these numbers with me. This state has one of the highest infection rates per capita in the entire world. 98% of those new cases are among the unvaccinated. That's according to the state's health department. 1,655 infected patients, 484 patients in the ICU right now, with 336 on ventilators. At this hospital where we are, they are up at a capacity level of 185%. Last week, they say they were having conversations about which patients they would need to take off of ventilators if they were to run out. And they say they were very close to having to make that call to actually ration care. In terms of the additional staff, Governor Tate Reeves announced on Tuesday that he, along with Mississippi's Emergency Management Agency, they were working with FEMA, and they're going to deploy over 1,000 additional healthcare workers from contractors, outside companies, to come and help at hospitals that need it. There are 61 hospitals in this state who have requested some sort of staffing assistance. This hospital is number 17 on that list. They have already started deploying nurses, respiratory therapists, and Savannah, they say that they will have help out at least 1,000 within about 9 business days from that initial announcement. Savannah.
Ellison, you just mentioned some of those things that I think we were all hoping we'd never have to hear about again, making those different types of decisions, difficult decisions about how to care for patients, what care, what type of opportunities patients are going to have to get the care that they need. And with a hospital like that working at double capacity, tell us more about what types of decisions they're having to make in terms of care for patients.
Yeah, I mean, this is a small hospital, a small rural hospital. We're about an hour outside of Jackson, Mississippi. We went inside yesterday to both the COVID ICU here and also the emergency room. Part of why we went into the emergency room is because they actually have patients there who need ICU beds, but they have nowhere to put them. We saw 2 different rooms where they had 2 COVID ICU patients in each room, all 4 of them on ventilators. They should be upstairs in the ICU, but they are way past their normal capacity level up there, and they literally have no space. They have 3 ER nurses working to take care of the ICU patients in the emergency room while the ICU nurses continue to treat and take care of the dozens of patients they have upstairs. Listen to what one emergency room nurse told us.
Heart attack, strokes, with nowhere to put them, no nurse to take care of them. We had patients in the waiting room that needed to come back so bad, and we couldn't bring them back. We had family members getting upset with us, but we had no choice. We were maxed out. We used the wall as a room, every inch corner of the wall. It was a nightmare. There was people everywhere.
Savannah, we hear so many times and we talk so often about how when we're discussing capacity, it is not just beds, it's not square footage, it is nurses, respiratory therapists, doctors who can give the level of care necessary. And obviously, just listening to what they're going through here, you cannot forget that other health issues, other emergencies did not stop because of COVID-19. And this hospital, they're seeing all of it. And they serve 5 different counties around them, and they really do not have the capacity, the means to keep doing this. Savannah.
Absolutely. And you think about those family members who are just waiting for help. And then, of course, the nurses. I know they told you that they are so tired. Ellison, really incredible reporting. Thank you so much.
South Dakota is now seeing a massive surge in COVID-19 cases 2 weeks after the Sturgis motorcycle rally. More than 500,000 people gathered for the yearly rally earlier this month. And according to NBC data, case numbers in the state have increased by 493% over the past 14 days. Now, it's still too soon to know if the rally had a direct effect on the increase or can be classified as a super spreader event. NBC News reporter Gary Grumbach joins us now from Sturgis. He was there 2 weeks ago, back again now. Gary, first, let's start by breaking down the numbers and where are the cases concentrated?
Hey there, Joe. Yeah, South Dakota is really reaching a breaking point here. We're seeing, as you mentioned, almost 500% change in number of cases from 2 weeks ago to today. And we're seeing a 17% positivity rate across the state, which means it's not just in any one area. It's not just anywhere. It's just everywhere across the state of South Dakota. And in Meade County specifically, 1 in 3 people that are testing for coronavirus are coming back positive. That's when we talk about community spread. That's how widespread and deep it is in these communities. 1 in 3 people. What's, of course, not helping here is the incredibly low vaccination rates across the state. We're seeing about a 55% vaccination rate statewide, but here in Meade County, where Sturgis is, where the rally was 2 weeks ago, it's less than 40%. And as we're seeing in the hospitals, 90% of the people in hospitals are unvaccinated. Joe?
And looking at the numbers there, you can see the positivity rate, 36% in Meade County right now. That is an incredibly high number. So in the wake of all this, the governor and other state officials, are they doing anything to try and handle this rise in cases?
Yeah, South Dakota Governor Kristi Noem has been very clear about the fact that she does not love mask mandates. She does not love vaccine mandates, and that's not going to happen in this state. Now, so doctors and people that are here, the people that live here in Sturgis, they're big on their personal freedoms. They do not want the government telling them what to do. And so doctors are really taking this into their own hands and how to get the vaccine out to people. Here's what one doctor we spoke to yesterday had to say about what he's doing.
Our approach has been, okay, what is making you not want to take the vaccine? And the more we can do that, we've seen a slight uptick in the vaccination right now. And that's the only way we see forward, because the other way we've noticed people tend to write us off or call us judgmental and not do the thing that would save our lives.
Now, for their part, the South Dakota Department of Health does tell NBC News that they are actively trying to track any cases that may have come from this year's motorcycle rally. Joe?
Hey, Gary, how are doctors and nurses there handling this huge rise in cases, and are hospitals prepared, and how are they preparing for next few weeks are probably going to be pretty rough?
Yeah, so the frustrating part of this for medical professionals is that they literally expected this, because this is what happened last year. After last year's motorcycle rally, the CDC says more than 400 cases came from the rally and ended up spreading and causing a rise in cases across the entire region. Right now in South Dakota, they're good on space, they're good on stuff in terms of PPE and ventilators, but they're going to be facing soon a real staffing challenge if cases continue in the direction they're going. They say they're ready to bring in the National Guard if needed.
Wow.
Joe?
Of course, the difference between this year and last year is that Delta variant. All right, Gary Grumbach, thanks so much for your reporting.
Let's now bring in Dr. Amish Adalja. He's a senior scholar at the Johns Hopkins Center for Health Security. Dr. Adalja, always great to have you with us. Now, as Gary just reported, it's still too soon to necessarily tell if the spike in COVID cases is linked specifically to the Sturgis rally, but just give us a refresher on super spreader events, holidays, these types of things where people get together. How long does it take to see a rise in cases and hospitalizations after an event like that?
So after a super spreader event, and those are areas where you have, or a certain event where you have a disproportionate number of spread, usually coming from maybe 20% of the people that are infected. It's kind of that 80-20% rule, where 20% of infected individuals are responsible for 80% of cases. And often it will be where there is high-risk environments, indoors, people doing certain activities that really increase the spread of whatever infectious agent you're talking about. And you will see cases go up in the next week or so after a super spreader event. It takes some time for hospitalizations to go up because they lag cases, because people have to get sick and people have to get sick enough to go to the hospital. And it's a little bit disrupted because of the fact that there is some level of vaccination, some level of population immunity. So it's not as correlated or as quickly correlated as it would be in the past. But certainly what happened in Sturgis isn't going to help, especially because the county that it occurred in is one in which vaccination rates are very, very low. We know how to do mass gatherings safe. We've seen it with Lollapalooza and other events. It just doesn't seem like many of the precautions were applied, all of the best practices during this rally, just like last year.
Now, Doctor, I want to talk vaccines. We had two pieces of news from Pfizer this week. Of course, that full FDA approval, but then also this booster dose, approving this booster dose for people to get of the Pfizer vaccine. So if many people haven't received any vaccine, they haven't got their first shot of any of the three that are available, what challenges do you anticipate in people actually going to get this booster shot, signing up for a third appointment in the case of these two originally dosed vaccines? Do you think people are going to go do that?
I do think that people who want to get boosters are going to get boosters, and polling shows that they do, even though there's a little bit of a debate in my field about what the need is for healthy people to get booster vaccines at 8 months when the vaccines are holding up against what matters, serious disease and hospitalization. What the problem we have in the United States is not getting third doses or second doses of the J&J into people's arms. It's first and second doses. That's what prevents what's going on in Mississippi. It's first and second doses, not third doses. So I think we have to think what we want to accomplish in this pandemic. And to me, it's decoupling cases from hospitalizations. And the way you do that is by getting first and second doses into people. And the third doses are going to really be preventing mild illness in vaccinated people. So that's something that people are questioning. What's the value of doing that? And how is that going to change the trajectory of the pandemic? So this is something that there needs to be a little bit more robust debate. We'll see if the FDA approves a third dose and what the CDC ACIP committee says about this. But there isn't strong clinical data that our vaccines are eroding against what matters, which is serious disease and hospitalization.
Dr. Adalja, final quick question for you. It's on this news about pregnant women in the South. They're seeing a rise in cases of COVID among pregnant women, and only 23% of pregnant women are fully vaccinated. So what would you tell pregnant patients who haven't been vaccinated about the vaccine, who might be nervous, thinking about their baby, and the risk they face if they contract COVID?
I would tell them to go right now and go get vaccinated, because you are at higher risk for having COVID-19 complications, COVID-19 hospitalizations, and your baby, your pregnancy is at risk for preterm labor and other complications if you were to contract COVID-19. The vaccines are safe and effective in pregnant women. We've got a lot of data. There's been a lot of myths that have been spread and lies that have basically harmed pregnant women because they haven't gotten vaccinated. This is something they need to do. They will pass antibodies through their placenta. This is something they all should be doing and should have been doing for a long time.
Dr. Adalja, as always, thank you so much for joining us.
Thank you.
Time to get a check on your morning news now weather.
That means that Janessa Webb is with us this morning. Hey, Janessa.
Hi, good morning. Man, we are dealing with the heat and humidity. It just will not back off. I know people are starting to think about fall. Well, at least I am. If you're across the desert Southwest into the central tier, even the Northeast, we are dealing with another heat wave that continues to build. Sections of the desert Southwest, we're looking at air temperatures of 117 degrees. But if you're across the East Coast, 69 million people impacted with heat advisories for today. That will extend into your Friday afternoon, and we're going to continue to watch some of these advisories really expand into the mid-Atlantic as well. So let's take a look at some of these temperatures. Air temperatures are going to fall in the lower to mid-90s, but the feel-like temperature this afternoon, we are talking about 110 degrees, and that starts to really extend into the deep south as we head into your Friday. Also watching a threatening storm heading for the weekend coming from the tropics. We will talk about that coming up, guys.
All right, Janessa, we'll see you then. Thanks so much.
Coming up, a major loss for the Biden administration involving the Trump-era Remain in Mexico policy.
Yeah, details on a new ruling by the Supreme Court and what it means for people seeking asylum in the U.S. after the break.
Texas Republicans could get their sweeping election bill to the House floor for a vote later today, 7 weeks after the start of that first special session aimed at passing the controversial legislation. In that time, state Democrats broke quorum multiple times to delay passing the bill. Democrats brought business to a grinding halt by leaving the state and heading to Washington. That move blocked any opportunity for Republicans to hold votes on the bill because not enough lawmakers were present. NBC News Now correspondent Priscilla Thompson's been in Austin for the better part of the 2 months following this story. So, Priscilla, we're talking about Texas Senate Bill 1 pretty much this whole time. Can you break down what lawmakers are scheduled to perhaps vote on today?
Yeah, Joe, good morning. There are a lot of things in this bill that Democrats are not too happy about. Senate Bill 1 would ban overnight and drive-through voting. That is something that Harris County near Houston did a lot of. It's a very diverse area that did that. And they didn't have any allegations of fraud in either of those two mechanisms of voting, but still, this bill would ban that. It would also create new criminal penalties for election workers. So again, in Harris County, they sent out unsolicited vote-by-mail applications to people who qualified, so people who were over the age of 65 or had a disability, and now that would become a state felony. Meanwhile, they're putting in extra protections for partisan poll watchers. They're also adding new voter ID requirements for vote-by-mail and new rules for people who are assisting people with voting. So, for example, if you're helping someone with a disability, there now are going to be new rules in place for that. There are two things in this bill that can be seen as a Democratic win, depending on how you look at it. One of them is that there's going to be an extra hour of early voting that is required. But Democrats say while that will be helpful in some rural areas that didn't have those extended hours, in a place like Harris County that was actually offering 24-hour voting, that's still a rollback for them. And the other sort of concession in there for Democrats is that if a vote-by-mail ballot is rejected, applicants are now going to have an opportunity to fix and correct any of those issues. So that's certainly seen as a win for Democrats. But overall, overall, they are not too happy with this bill. Joe?
Yeah, I mean, any of those concessions are obviously small for Democrats. Why do they so strongly oppose this bill, so much to the point that they went to Washington for weeks and tried to pressure Democrats at the federal level to pass some sort of federal law?
Right. So Republicans say that this bill is going to, quote, make it easier to vote, harder to cheat. But Democrats are saying that is absolutely not the case. This is going to disenfranchise black and brown voters, voters with disabilities, and make it harder for those groups to cast their ballots. And to your point, it is why Democrats walked out in the final hours of the regular session in May. It is why they spent 5 weeks in Washington, D.C. during that first special session in July. And it's why they have largely been missing from this second special session that's taking place as we speak. Joe?
All right. Priscilla Thompson. Priscilla, thanks for your reporting. Appreciate it.
There's been a big setback for the Biden administration's immigration efforts. Almost immediately after taking office, President Biden made a massive change to U.S. policy, ending the Trump-era return to Mexico asylum policy. But the Supreme Court has smacked that down, ordering the White House to reinstate it. NBC News Justice correspondent Pete Williams explains.
It's one of the first things President Biden did after taking office, ending a Trump administration program known as Remain in Mexico. It required people seeking asylum to wait outside the country while their claims were considered. Tens of thousands lingered in makeshift tent cities. Human rights groups said many were attacked by criminals and drug gangs.
People were kidnapped, people were raped, all kinds of terrible things happened to these people while they were trying to get protection under the laws of the United States.
But lower courts ordered the Biden administration to reinstate Remain in Mexico. And late Tuesday night, the Supreme Court refused to intervene. The court's 3 liberals said they would have blocked the program. Texas and Missouri had sued to get it going again, arguing that when President Biden stopped it, the number of migrants trying to enter the country skyrocketed, because migrants know that even though the vast majority of asylum claims are rejected, most people are released in the U.S. to wait.
It takes that incentive away, and I think you're going to see a reduction in the numbers. I mean, over 1.1 million people have illegally entered the country, at least that we know of, since January. We have to be able to stem that tide and get control of our border.
But the U.S. can't simply flip a switch and restart this program on its own. It'll once again need the cooperation of Mexico, which was not involved in this lawsuit and is not happy about this development. Joe, Savannah?
Let's take a look at what's making news around the world this morning.
Ali Arouzi joins us today from Tehran. Good morning, Ali.
Good morning, Joe and Savannah. Australia has registered over 1,000 new daily cases of COVID-19 for the first time since the pandemic began. The country is struggling to contain the fast-spreading Delta variant, even after 2 months lockdown. A spike in patients seeking medical care has forced 2 major hospitals in Sydney to set up emergency outdoor tents to deal with the overflow. However, in neighbouring New Zealand, Prime Minister Jacinda Ardern says the strict nationwide lockdown is helping to contain the spread of the Delta variant, even though new cases rose slightly. The entire country, including schools and most workplaces, will stay shut till at least the end of the month. And Mexico has granted humanitarian protection to over 100 Afghan journalists and their family. The group, whose lives would have been in danger in Afghanistan, arrived in Mexico City yesterday. Their travel and living costs during their stay in Mexico will be covered by private sponsors and civil society organizations.
All right, Ali, thanks so much. Appreciate it.
Coming up, a major airline essentially charging its own employees if they don't get vaccinated.
Our own Danny Savalos gives us the legal lowdown on Delta's controversial new policy and whether this could be something other companies start rolling out next.
Welcome back. Veteran sportscaster and former Dancing with the Stars co-host Erin Andrews is opening up about her IVF journey, which she has privately undergone since age 35. In a personal essay she shared on Facebook Bulletin, the now 43-year-old Andrews said she does not want to keep this a secret anymore and vowed to be vocal and honest about her journey. Andrews, who is the lead sideline reporter for Fox Sports' NFL broadcast team, said she was stressed, juggling fertility appointments ahead of NFL kickoff next month. She also wrote that if Tom Brady can win his 7th Super Bowl at age 43, then she can continue her journey to parenthood at that same age, which I think is an amazing message.
That's a good way to look at it. We wish her all the best.
Absolutely.
All right. Thank you, Savannah. With the Pfizer vaccine gaining full FDA approval this week, more businesses, large and small, are requiring employees to get the shot. But Delta Airlines, which employs 75,000 workers, is charting a different route by hitting the unvaccinated in their pocketbooks. Take a listen to Delta's CEO.
November the 1st, we're going to implement an insurance surcharge such that if you're not vaccinated at that point, we're going to add a $200 monthly premium surcharge onto your health insurance costs, because this is not just costing lives, this is costing us financial resources as well.
NBC News legal analyst Danny Ceballos joins us now. Danny, good morning. So we know debates raging over vaccine mandates, but this is something different. So the reason we have you here is to help us answer the question, can Delta impose this extra fee on its workers?
Yes, but it might have been easier for Delta to just tell its workers, thou shalt get the vaccine or you can't work here. Legally speaking, that's probably easier for employers to mandate the vaccine, especially a common carrier like a hotel or Delta, than to create this insurance surcharge. Now, legally, they can do it because employers for many years now have been allowed to create these wellness programs where they incentivize by either rewarding or essentially punishing folks who don't do certain things that are for their health. But legally, it's a trickier thing to do than simply mandating the vaccine and just not dealing with a surcharge. But Delta apparently wants to give its employees choice.
The smoking surcharge seems to be the one that comes to mind, perhaps, for most people. So FDA approval does seem key here. How much power does that FDA approval give employers to create these carrot and stick initiatives? And do workers who don't like this have any recourse?
First, the workers who don't like this absolutely have a recourse. Don't work there. That is pretty clear from a case that goes all the way back to 1905 by the Supreme Court, which said that, say, municipalities, for example, can simply force people to go get vaccines. It seems to follow that private companies, for example, can make a condition of employment getting the vaccine as long as, and I caution, as long as they don't discriminate against people with a particular disability or say they discriminated based on race or age and said, oh, only people over 50 need to get the vaccine or something like that. All those things aside, an employer almost certainly can require the vaccine as a condition of employment.
Now, because mandates have become so controversial, do you think surcharges like this might become a more common option for companies that don't want to do these mandates?
Yes, but only if the employers are feeling pretty charitable, because it creates administrative additional work for companies like Delta, when, as I said earlier, they can just mandate the vaccine and cut through a lot of the red tape. But Delta says apparently it's committed to giving the employees this choice. And if they choose to not get vaccinated, they simply have to pay more on the insurance side. I mean, look to that to be challenged and arguably create more problems for Delta than if they had simply required their employees to get the vaccine.
And Danny, some wonder if this could also lead to a labor dispute, as Delta has negotiated health care plans already in place with the union that represents its 12,000 pilots. Is this change any sort of breach of that agreement?
Yes, Delta actually pays for its own insurance costs and then hires an insurance company to sort of administer the process, which is a little different than other companies that simply hire outside insurance companies. But yes, this could become a bargaining chip in a labor dispute. So I would look to that to be an issue in the future.
All right. Danny Ceballos. Danny, thanks for your expertise on this topic. Appreciate it.
You've heard the stories of people getting COVID even though they were vaccinated. And we've also heard that breakthrough infections are rare. But the numbers are now going up. So what's the real risk? NBC News senior medical correspondent Dr. John Torres takes a look.
By the numbers, breakthrough infections appear to be rare, yet many across the nation know someone who's had the shot and still got COVID. Actresses Hilary Duff and Melissa Joan Hart are both reporting breakthrough cases just last week.
I got COVID. I am vaccinated, and I got COVID, and it's bad. It's weighing on my chest. It's hard to breathe.
Americans are asking, how worried should the vaccinated be when it comes to catching COVID? A lack of data is making this question hard to answer. NBC News' investigative reporter, Laura Strickler, has been tracking breakthroughs state by state since the beginning of July.
You don't have the CDC requiring every state to provide them with standardized case numbers. So you have certain states that are collecting comprehensive information on breakthrough infections. But then you have a state like Illinois who is not providing with the public with any figures around breakthrough cases.
One state that has provided consistent information is Louisiana, where the unvaccinated make up 89% of COVID cases and 91% of hospitalizations, or more than 2,700 beds filled. As for breakthroughs,
when we went to them a month ago, around July 15th, they had a little over 2,000 cases, 2,000 breakthrough infections. They have now over 14,000. So that's just a month later.
But that's still less than 10% of the more than 150,000 new cases diagnosed in Louisiana since July 15th, where about 40% of people are fully vaccinated. Data from that state and others tracking breakthroughs like Oregon seem to indicate that vaccinated people are testing positive at a much lower rate than those who are unvaccinated. The other good news is vaccines seem to protect against severe COVID, and most people with breakthrough infections have reported mild symptoms, if any at all.
Well, mild in 96%, moderate in 3%, severe in less than 0.05%, with death in less than 0.05%.
But for some, breakthrough COVID can be a shock to the system. Adam Rothman, who received 2 shots of the Moderna vaccine, told NBC News' Vicki Nguyen his infection was no walk in the park.
Fever, chills, fatigue. I had a terrible headache. I was quite sick, and my wife was too.
Outcomes can be far worse. At least 7,800 breakthrough hospitalizations and 1,800 deaths have been reported to date. That's out of what NBC estimates is more than 290,000 breakthrough cases across the U.S. Still, a pretty small number compared to the nearly 190 million Americans who have gotten vaccinated since the beginning of the year. But the data from other countries that are closely tracking the real risk of breakthroughs tells a cautionary story. In Israel, nearly 60% of all hospitalized patients are fully vaccinated. It's part of why the country is recommending another shot for protection. Those most at risk tend to be older Americans, typically age 65 and up, according to the CDC and data from Israel as well. Breakthroughs have been seen with Moderna, Pfizer, and J&J vaccines. But because they've been rolled out at different times and given to people with different backgrounds, it's difficult to compare them head-to-head. Experts warn breakthrough infections are likely to rise in the coming months, regardless of which shot you got. It's the fact that vaccine immunity is waning, the Delta variant is spreading quickly, and there's a huge number of unvaccinated people. All of these things coincide with breakthrough cases in the middle. That's why getting the shot and measures like wearing masks indoors, limiting large gatherings, and practicing social distancing are still the best weapons against the virus.
Coming up, reclaiming their time, Black women at the forefront of prioritizing their mental health, even if it means risking their careers.
We'll talk to an expert about the high-profile examples leading the way for others to put themselves first. We've watched as superstar athletes Naomi Osaka and Simone Biles revolutionize the sports world by risking their careers to prioritize their mental health.
Their decision sparked a flood of social media reactions applauding the women for their bold decisions. Now, more Black women are taking the time they need to step away from one of the most exhausting years, and honestly, a year and a half in recent history. Dr. George James is a licensed marriage and family therapist at the Council for Relationships. He joins us now with more. Dr. James, Good to have you with us. I mean, first of all, just tell us, why are Black women experiencing such high levels of burnout, both their professional and personal lives? Is it that they're held to different expectations?
You know, first of all, I can't discuss this or say that I know everything for every Black woman that works or that is out there. But I think it's great that we're talking about this topic because it is something that has been going on for a very long time. And Kimberly Crenshaw, who developed and introduced the term intersectionality, talks about how people can experience multiple layered isms, injustices. And for Black women, racism and sexism is at the heart of this. What they've had to accomplish, what they have to go through just to be seen, just to be treated fairly is really exhausting and overwhelming. And I think that's at the heart of why so many Black women are saying, I'm overwhelmed, I've done this for too long, and I need to take a break.
Yeah, I love that you point out, of course, we can't explain every experience in this. And actually, to that end, I'd like to put it in the words of someone who's experienced this rather than myself. This comes from an article in the Washington Post that kind of inspired this segment that's in part titled Black Professional Women Are Exhausted. One of the women quoted said, Black women have been groomed to overachieve. What role do you think cultural attitudes like that play in this type of burnout? And what happens to Black women when we invalidate their exhaustion? We don't see it, we don't honor it.
You know, unfortunately, this shows up in so many different ways, even from like when Black women go to medical professions, reporting the same symptoms and signs that we would say that's a heart attack, that's a red flag, let's get some care. They're told to just push through it. And so this thought of the superwoman, the super Black woman happens in the dominant culture and also sometimes in the Black community, right? The thoughts of that you can do it all, you can do everything. Now, there's some good to that, the thought of, wow, you're so amazing, so great. But at the same time, that's such a burden to carry that the only way that you're seen is if you are literally a superhero when we don't hold everybody else to that same standard.
So what's the advice? What can be done to protect mental health at work without feeling guilty or fear that they may lose their jobs in the process? What advice do you have?
Well, I think like having these conversations, being able to talk about like the importance to treat everyone fairly, to be able to recognize what is a microaggression, that telling somebody to push through it, telling a Black woman just deal with it is a microaggression, and that is not okay. Being able to say it's okay to take a break, to take the examples of Simone Biles and Naomi Osaka, that it's okay to say, you know what, I'm going to step down for my mental health. And then personally, what I would encourage every Black woman to say, it's okay for you to put you as number one and not everybody else.
What did you think when you saw Simone and Naomi take the steps that they took?
You know, as a mental health practitioner, a licensed therapist, there was a part of me that was excited to say, yes, we must put our mental health first. We must make that a part of the conversation and model that. Right? I was sad by everything they had to go through and that they had to feel like they were at the brink of like their life and their mental health to be able to make this decision. But I was glad that we were talking about this in sports, in entertainment, in our everyday life. We need to focus and put mental health first.
And I think it's so important to see examples like that because especially at that level of notoriety, of fame, to see that it didn't hurt them, it inspired people. So hopefully people can take that kind of lesson in their own day-to-day jobs and lives. Dr. George James, thank you so much for joining us for this important conversation.
Thanks, Savannah. Thanks, Joe. I really appreciate it.
Time now for our CNBC Money Minute, the biggest financial headlines of the day and why they matter to you.
Bertha Coombs is with us this morning. Hi, Bertha.
Hi, Joan, Savannah. So the big tech titans descended on the White House yesterday. Google, Microsoft, and other tech companies are promising to boost cybersecurity after their CEOs met with President Biden. The meeting follows a series of high-profile cyber attacks, including that big one on the Colonial Pipeline. You might remember the one on Meatpacker JBS. Google now says it will spend $10 billion and train 100,000 people in fields such as IT support and data analytics. IBM also pledging to train people as well. Microsoft committing $20 billion on advanced security tools and will help the government upgrade its security systems, while Amazon Web Services says it's going to give users free multi-factor authentication tools, she tried to say, to better secure their personal data. The CEO of CloudSoft maker Salesforce says some companies have been surprised by their employees' desire to keep working from home, but he's it's not. Mark Benioff telling CNBC that's because he's seen that employees have proven they can be productive at home and successful anywhere. Benioff says that he expects more than half of Salesforce's staff to work remotely post-pandemic. And the head of Australia's Qantas is hoping to resume international flights to the US, UK, and parts of Asia by Christmas. That's based on the assumption that Australia's most populous states, New South Wales and Victoria, will lift their border restrictions to the rest of the country by December 1st. Qantas' CEO telling CNBC there's huge underlying demand and people don't want to spend another holiday season isolated from their families. Yeah, I know a lot of folks really anxious to travel, but it's tough when you see these Delta variant surges. It makes you rethink your plans.
Yeah, a lot of people have been rethinking, I think, travel for this year. Though Australia does sound lovely.
Yeah, it does, but sad when vacations are on hold.
Thank you, Bertha.
Coming up, they're meant to keep people safe from COVID-19, but could those contactless QR codes you see everywhere be compromising your privacy?
Well, some experts say scanning in could end up putting you out. Next. If you own a smartphone and went out to eat during the pandemic, you may have come across a QR code menu. Restaurant owners flocked to the contactless system to try and lower the risk of COVID transmission.
But what if these QR codes are exposing you to a different kind of risk? NBC News technology correspondent Jake Ward takes a closer look at how the latest tech trend may be infringing on your privacy.
I'm tired. At El Centro in Manhattan, diners scan a code at their table with their phone to view the menu, order food and drinks, and pay their bill, all without having to flag down a server. Owner Marin Powell says these QR codes help them keep costs down during the difficult months of the pandemic.
So we've been short-staffed, and we could absolutely never have been able to accommodate our business without this.
Powell's daughter, Nora Dempsey, helped introduce QR codes here. She says this system makes everything faster and easier, especially for those already using their phones to pay.
And you can use Google or Apple Pay, so people who are already familiar with using a digital wallet, they find that the system is pretty easy to use.
Manager Matthew Morfitt says when each person uses the code to create a separate tab, splitting the check is easy. And as far as having phones at the dinner table, well, Morfitt says it doesn't hurt your evening out.
There's still humans here. You still get the human interaction. It's just now you can also send a margarita from your phone.
But every time we scan a QR code, we are handing over information that restaurants and retailers can use to track our behavior over time. Powell says El Centro doesn't do this. It only uses information from customers to find a receipt if someone calls later to request one. But the technology could be the end of anonymously plunking down a few bucks and walking out the door. About 1.3 million U.S. businesses, including CVS, Foot Locker, and Nike, are now accepting payment via PayPal QR codes. And that number does not include businesses using other QR companies like Checkout and SquareUp. Those codes can be hugely helpful to businesses. They can personalize a coupon or ask you if you'd like what you had last time. And with vivid photography in an online menu, it turns out we have a harder time choosing between one dish and another.
What we're seeing is that when people can actually see those pictures of what the food looks like, they order both. They don't just choose one. So you get a slight uptick in sales there.
Joe DePinto and Daniel Wagner co-founded BarPay, a digital QR payment system, in 2015 after they met playing professional baseball. They got tired of waiting around for drinks after games and wanted to order via their phones. Restaurants that use BarPay only need printers and QR codes on tables to get started, and customers only have to put in their name. No accounts or special apps to download. But if you want a receipt, you have to add an email address. And BarPay allows retailers to spot patterns in our behavior without giving away identifiable information.
You know, if you're a major liquor provider or if you're a beer, we have all sorts of data now on, you know, specifically what type of person. Obviously, they're not getting their name or email, but, you know, who's ordering what times are these typical items being sold. So we can do some pretty cool things with data.
But some experts say QR codes collect far more data than we realize.
There's an entire online industry devoted to tracking people online.
And a lot of what these advertising companies want to do is they want to extend that traffic to the offline world. And by scanning a QR code, you are allowing them to do that. You know, as a consumer, you should treat a QR code like an unknown link in an email that you get. Don't click on it unless you are very sure from the overall context that you can trust whoever it is that provided you.
But for businesses that have come to rely on them this year, digital payment systems like QR codes may be here to stay.
Or you can do what my father does and have a flip phone.
And so he needs a real menu. Or he needs to share your phone.
Exactly. That does it for this hour of Morning News Now.
But the news continues right now.